Hello everyone, I'm Dr. Dale Rodrigues. I'm a surgical oncologist. Today I'll be speaking to you on breast cancer awareness. 1 in 8 women have been diagnosed of breast cancer in their entire lifetime. So it is that common, 1 in 8 women. About 60% of these breast cancers which are diagnosed in India, they are in the advanced stage. So the point of having this talk is to detect breast cancer in the early stage. So what is breast cancer exactly? Breast cancer is cancer of the breast ducts or the breast lobules, which is nothing but the milk ducts of the breast. So what are the risk factors for patients who get breast cancer? The risk factors are early menarche, late menopause, not having children, not breastfeeding your babies, having a strong family history of breast cancer, and many more other factors related to hormones. So basically breast cancer is a hormone dependent cancer, and it depends on the number of cycles of hormonal changes. So what is the age group that we are looking at? The age group is around 50 to 60 years, but in the recent trend now we are seeing breast cancer even coming up in ages up to the age of 30-35 years. So it's coming into the younger age group as well. The detection rate has increased because awareness has increased. What are the symptoms? The symptoms of breast cancer most commonly is a breast lump. A lump in the breast is to be not taken lightly. You should come to your doctor with the complaint that you are having a breast lump and get it checked. Another symptom is discharge of blood from the nipple. So if a cancer is growing in the duct of the breast, that cancer will bleed into the duct and that blood will come out through the nipple. So this is one of the symptoms of breast cancer. A third symptom of breast cancer is either dimpling of the skin or a retraction of the skin or a pulling inward of the nipple. That is also because the breast cancer within the ducts is contracting and pulling in the skin or the nipple. A fourth symptom is redness or rash over the breast, which is probably a symptom of advanced cancer. And the last symptom is fungation or ulceration of the cancer from the breast, which is nothing but an open wound because the cancer has broken out through the skin of the breast. So how do we detect breast cancer? So breast cancer or breast lumps can easily be detected by knowing a simple self breast examination, which is available over the net, over the internet, in various forms and various pictures where you can do it on your own. So it is basically 3 things. First, you look at yourself in front of the mirror while bathing and while lying down. There are simple steps. We'll be adding that slide to this video in case you require it. So when do you need to see me? You need to see me when you either have a very strong family history of breast cancer, not only breast cancer but also ovarian cancer or a colorectal cancer. These cancers are linked to each other, so you should be vigilant and get yourself screened if you have a strong family history of cancer. The second thing is you should be screened if you are above the age of 50 years in India. In the US the criteria is 40 years, but in India it is 50 years. You should be screened with a regular screening mammography at least. And this should be done at regular intervals of at least about a year. So what do we do next if you have a breast cancer detected? So the first thing that we do is a mammography along with a sonography of the breast, which is called a sonomammography. The second thing that we will do is we'll do a biopsy. What is a biopsy? A biopsy is a small piece of tissue which is taken out from the breast and it is sent to the pathologist to check under the microscope for any cancerous cells. So once that report is ready, then we come to know whether you have a cancer or no cancer. So after that, once the diagnosis of cancer is certain, then we decide what treatment to be done. So what is the treatment? The treatment is basically surgery, or surgery followed by some form of treatment, that is either chemotherapy or radiation or hormonal therapy, or the newer recent advanced targeted therapy. So we'll take one by one. So what do we do in surgery? So surgery would entail either complete removal of the breast or a part of the breast. Which one to do will be depending on the site of the tumor, whether it is in the center or at the periphery. If we do a complete removal of the breast, most likely you may not need radiation. If we save the breast, then you will definitely require radiation to the entire breast. Chemotherapy will depend on the final report, which comes after 15 to 20 days, or rather 15 days. Then we decide on the chemotherapy factors. Another way of looking at the treatment option is giving you chemotherapy first, but that will depend on the tumor size. So chemotherapy before the surgery or after the surgery, both are options. That is decided by the surgeon, the chemotherapy doctors and the radiation doctors. The last I would like to tell you is about the survival. So the point in having this awareness video is because that we need to detect you in an early stage and not in the advanced stage. In India, as I told before, 60% of breast cancers are detected in the advanced stage. So in this awareness video, we want you to learn self-breast examination, and we want you to detect you if you have a breast cancer in the early stage. So what are the stages? Stages 0, 1, 2, 3, 4. Fourth is the last stage, and 0, 1, 2 are the early breast cancers, early stages. So the survival rate of early breast cancer, that is stage 0, stage 1 and stage 2, is almost 95% to 98%, the survival rates. But as you reach stage 3, stage 4, the survival rates drop down to 70% and 24%. So the point is to detect you in an early stage, to help you learn self-breast examination, and to detect you and have a good survival outcome of this. So if you want to get in contact with me, I am on Librate.com. You can directly call me through Librate.com. You can message me, you can have a voice call, you can have a message, and you can also mail me. Thank you so much.